Hi folks, back again. Well, I don't know about this one. Bathrobe Chronicles, and I think it's number 114. I just made a note, but anyway. Yep, this is another one of those where I'm not sure exactly why I'm doing this. Not sure exactly what I hope to accomplish, if anything. It's another one of those that it may not be posted, if you will. And if I do post it, maybe I will regret it. And no, I haven't run out of material. I've got, most likely another 8 or 10 things that I could rant about. But I don't know. For some reason, the other day, I ran across this article, I guess on CNN or something, about a woman who had, as I remember, 10 or 11 plastic surgery procedures in one day. And, I just, anyway. And for some reason today I was thinking about that. I'm not sure exactly why. And I did a little search and went back and I found it. And it's a woman named Heidi Montag, M-O-N-T-A-G. And I think she had these surgeries over the past 2 or 3 months. I'm not sure. Man, she had herself overhauled. I mean overhauled. She had stuff sucked out, she had stuff injected, and it just sort of got me to wondering, or thinking, if you will. That's a bad deal. About what's the motivation for these things. I would imagine, excuse me, I would imagine on the simplest level. And by the way, I most likely don't know what I'm talking about, more so than usual, okay? Keep that in mind. I would imagine on the simplest level or something, we would say, well, we do these things to enhance our looks. And then we might follow that up with, well, why do we need to do that? In other words, are we doing this so that when we look in the mirror, we feel better, whatever that means, about how we look, or are we doing this so that when we present ourselves out in public, we feel as though we look better, so that other people will look at us and say, oh gosh, he or she looks better. Combination, A couple of other, I got a bunch of notes. I don't even know if I'll get to them or not. And as I said, this one may well not be posted. But I guess the case I would like to make, or maybe think about, is instead of spending several $1,000s, well, let me back up. Okay, there's a difference between being in a horrible accident, being burned, or what have you, and have like reconstructive surgery, I guess they would call that. Okay, let's forget that. What we're talking about, regular looking kind of folks who go have their boobs enlarged, their butts shortened or lowered or whatever, lipo this and all the other kind of stuff. That's what I'm talking about. I'm not talking about someone who's had a horrible accident. Okay. And I guess I would pose the question, wouldn't it be better to, let's just assume that for whatever reason, you have something about you that you don't think is all that attractive or whatever, or that you would like to make it more attractive or whatever. Wouldn't it seem better to try to work on our self-worth, or whatever term you want to use, and instead of spending thousands of dollars that most people don't have, just to piss away, so to speak, on this plastic surgery? Wouldn't it be better to try to say, hey, wait a minute, what the heck, folks can accept me like I am or not. Now, I don't know if I'd mentioned this earlier, but we all, in many different ways, most likely, try to make ourselves look better, either because we like looking better, or we want other people to see us looking better. I mean, on the simplest thing, most of us, when we get up in the morning, we brush our teeth, do whatever we do, we comb our hair. Well, some of us do, and I mean, that is to make us maybe more presentable. Of course, in the workplace, most workplaces, you have to look fairly presentable anyway, because that's sort of the deal. Okay, so on the simplest level, we all do that, either consciously or otherwise. But what I'm talking about is men and women paying big bucks to have themselves altered, to have themselves hacked on, which also brings, you know, we could pose other questions too. For instance, I remember there was a program 5, 6, 7, 8 years ago or something, and the program was about families, parents, if you will, who, for their daughter's graduation from high school present, were giving them boobs, bigger boobs. And I don't know, I guess that raises a couple of questions too. What's this message, as we normally say, that the parents are giving their 17-year-old daughter, 18-year-old daughter who's graduating from high school? What's the message here? Hey, we're going to give you boobs? I mean, what kind of message is that when you get right down to it? Excuse me. I think another question it brings up too: who are these plastic surgeons? In other words, are there ethical dilemmas? You know, when someone comes in, like if a lady comes in and says, I want boobs that are, you know, like weigh 800 pounds or something and stick out to here, are there any kind of ethical dilemmas here that's posed for this surgeon? In other words, I mean, number one, using the big boobs kind of thing, I mean, come on, it's got to be horrible, like backaches or something, you know? Plus, I mean, you look like a freak. I mean, you know, I'm talking about, you know, those ones that, you know, come out to here. I mean, come on. Then you could pose another question. If you're doing this to attract people, what kind of people are you attracting? I mean, come on. Okay, well, let me go to part 2. I'm not sure how well I'm going to do on this. I'll be right back.